Welcome to This Week in Allergy and Immunology. This week, we are synthesizing key findings from several landmark publications that collectively reshape our understanding of pediatric asthma monitoring, food allergy management, advanced targeted therapeutics, and the profound influence of the gut microbiome-diet axis on systemic immunity. We will explore how clinical practice is shifting toward objective physiological measurements in asthma, individualized dietary challenges in food allergy, and the real-world economic realities of advanced immunotherapies, while also looking ahead to the next generation of highly targeted mast cell therapies and metabolomic predictors of immune response. Let us dive in. We begin this week with a deep dive into pediatric allergy and asthma, where two new studies challenge our reliance on subjective clinical assessments and conservative avoidance strategies. First, a retrospective cross-sectional study. Asthma and Immunology investigated the prevalence of unrecognized small airway dysfunction in young children with asthma. While current guidelines are generally effective at controlling symptoms, many children still experience unexpected exacerbations. To understand why, the investigators evaluated 53 children between the ages of 2 and 7 who were classified as having primarily mild, well-controlled asthma. Using a C100 airwave oscillometer, they measured respiratory resistance and reactance, defining small airway dysfunction based on abnormal Z-scores for key oscillometric parameters. Remarkably, nearly half of these supposedly well-controlled children, 49.1%, had objective evidence of small airway dysfunction. Furthermore, over 43% of the children had a history of asthma exacerbations in the preceding year. When the researchers combined small airway dysfunction and prior exacerbations to define a high-risk phenotype, a striking 74% of the cohort met the criteria. Despite this high-risk status, there were no significant differences in demographics, prior year exacerbations, or treatment patterns across the groups, and only 41% of the high-risk children were receiving Step 2 or higher therapy. This mismatch highlights a critical clinical blind spot. Relying solely on symptom reports can cause clinicians to miss significant underlying physiological dysfunction, leaving highly vulnerable children undertreated and at risk for future exacerbations. Incorporating objective tools like oscillometry into routine pediatric asthma care could help identify this silent phenotype and guide more appropriate, proactive therapy. In a related effort to refine pediatric management, another study in the Annals of Allergy, Asthma, and Immunology addressed the common clinical dilemma of sesame seed tolerance in children with a history of reacting to concentrated sesame products. Concentrated forms of sesame, such as tahini or halva, are highly potent and frequently trigger severe allergic reactions in early childhood. However, it has remained unclear whether these children must avoid all forms of sesame, including intact sesame seeds. To resolve this, researchers conducted a retrospective chart review of 27 pediatric patients with documented immunoglobulin E-mediated sesame allergy, who underwent supervised oral food challenges to intact sesame seeds. These challenges were performed between 6 months and 4 years after the child's most recent reaction, with a median interval of 2 years. Using a standardized, stepwise dosing protocol, up to a cumulative target of 1 to 3 teaspoons of sesame seeds, the results were highly reassuring. 85% of the children tolerated the intact sesame seeds without any clinically significant symptoms. Only 4 patients, representing 15% of the cohort, developed objective allergic reactions requiring treatment, with symptoms occurring after ingesting between 50 and 500 milligrams of sesame protein. These findings suggest that clinical reactivity to concentrated sesame does not automatically equate to a complete intolerance of intact sesame seeds. Supervised oral food challenges are therefore a highly valuable tool for individualized dietary counseling, allowing the vast majority of these children to safely expand their diets and improve their quality of life. Moving from pediatric clinical management to advanced immunological therapeutics, we look at 2 papers that contrast the future of highly targeted molecular medicine with the real-world practicalities of current advanced therapies. In the Journal of Allergy and Clinical Immunology, researchers have unveiled a sophisticated nanomedicine platform designed to selectively eliminate overactive mast cells while avoiding systemic toxicity. Mast cells are central drivers of both malignant disorders, like systemic mastocytosis, and non-malignant conditions, such as severe allergic and inflammatory diseases. However, existing therapies often lack specificity, leading to significant off-target side effects. To address this, the investigators targeted Siglec-6, a receptor predominantly expressed on mast cells. They developed a therapeutic strategy, termed anti-Sig6-NP-MitoFab, which combines nanotechnology with cell-free protein synthesis. This platform utilizes nanocarriers loaded with the protein kinase inhibitor midostaurin, which are then conjugated with synthetically dimerized anti-Siglec-6 antibody fragments. Testing this construct across human mast cell lines, primary human mast cells, a Siglec-6 knock-in mouse model, and a humanized mast cell malignancy mouse model, the authors demonstrated highly selective elimination of Siglec-6 positive mast cells. Crucially, the therapy showed minimal off-target effects on Siglec-6 negative cells. This highly precise nanodelivery system represents a major step forward in mast cell-directed therapy, offering a potential blueprint for treating a wide array of mast cell-mediated diseases, with a much improved safety profile. While such highly targeted therapies represent the future of immunology, a study in the World Allergy Organization journal reminds us of the substantial real-world challenges associated with administering and paying for our current advanced immunotherapies. The investigators evaluated real-world treatment patterns, compliance, and healthcare resource utilization among patients with hereditary angioedema receiving non-androgen long-term prophylaxis in the United States. Using the IQVIA PharMetrics Plus database, they analyzed claims data from 328 commercially insured patients between January 2016 and September 2023. The findings reveal a significant gap between clinical trial efficacy and real-world effectiveness. Within just 1 year of initiating long-term prophylaxis, 55% of patients either experienced significant refill gaps, discontinued their therapy, or switched to a different prophylactic agent. Furthermore, over 2/3 of the patients, 67%, still required on-demand therapy for acute attacks during the follow-up period. For patients who maintained excellent adherence with no or minimal refill gaps, the annualized mean on-demand therapy doses decreased significantly from 20.8 pre-prophylaxis to 12.4 post-prophylaxis. However, for patients with refill gaps or those who switched therapies, there was no statistically significant reduction in on-demand therapy use. Healthcare resource utilization also remained high, with 17% of patients requiring at least one hereditary angioedema-related emergency room visit and 8% requiring an inpatient admission during follow-up. Most strikingly, the financial analysis showed that total annual hereditary angioedema-related healthcare costs per patient more than tripled, rising from approximately $165,000 pre-prophylaxis to over $515,000 post-prophylaxis. This massive cost increase was driven entirely by the pharmacy costs of the prophylactic agents, which averaged nearly $396,000 per patient per year. This expenditure was only minimally offset by a modest reduction in emergency and inpatient medical costs, which saved an average of just $8,344 per patient. These findings underscore that starting a long-term prophylactic therapy is not a simple cure-all. Clinicians must closely monitor adherence, manage the substantial economic burden, and ensure that all patients retain reliable access to on-demand acute treatments as the foundation of their care. Finally, we turn to the gut mucosa and the systemic metabolome to explore how diet and microbial communities shape both local and systemic immune responses. In a comprehensive review, authors synthesized recent insights into the complex, multi-directional interactions occurring at the intestinal mucosal barrier. This barrier is a highly dynamic site where epithelial cells, immune cells, dietary antigens, and microbial communities constantly communicate to maintain homeostasis and prevent inappropriate immune responses. A central player in this crosstalk is the intestinal mucus layer, which acts not only as a physical barrier, but as an active mediator of host microbial signaling. When these intricate mucosal networks are disrupted, immune tolerance breaks down, paving the way for allergic sensitization and the development of food allergies. The authors highlight that targeting these mucosal interactions to restore homeostasis offers immense therapeutic potential, though the sheer complexity of the diet microbiome host network remains a major hurdle that requires further mechanistic exploration. The systemic relevance of these diet microbiome immune interactions is vividly illustrated by a landmark study, which identified key metabolic and microbial determinants of cancer immunotherapy outcomes. Immune checkpoint inhibitors have revolutionized cancer care, but only a subset of patients derive long-term benefit, and the metabolic factors driving these differences have been poorly understood. To investigate this, researchers profiled over 4,300 plasma samples from more than 1,700 patients across 5 different tumor types and 16 cohorts in Europe and North America. By integrating targeted metabolomics and metagenomics with clinical variables through a multimodal machine learning framework, they identified 5 key metabolites, along with age, body mass index, and renal function, as strong predictors of 12-month progression-free survival. Among these, the amino acid histidine emerged as a highly favorable prognostic marker, whereas long-chain fatty acids and succinate were negatively associated with survival. In preclinical mouse models, dietary histidine supplementation directly enhanced anti-tumor immunity. In cancer patients, histidine-rich diets were associated with significantly improved progression-free survival, but only in those who lacked a dysbiotic gut microbiome signature characterized by histidine catabolizing bacteria. This elegant study provides direct clinical evidence that systemic immune responses, even in the context of advanced oncology therapies, are profoundly modulated by the interaction between specific dietary components and the metabolic activity of our gut microbiota. It underscores a universal immunological truth. Whether we are trying to induce tolerance in food allergy or maximize immune activation in oncology, we must look at the patient's metabolic and microbial baseline as a primary driver of immune function. If you only have time for one paper this week, make it the study on small airway dysfunction in pediatric asthma from the Annals of Allergy, Asthma, and Immunology. This clinical investigation reveals a highly prevalent, unrecognized high-risk phenotype in children with supposedly well-controlled asthma, suggesting our current symptom-based treatment strategies may be leaving many young patients unprotected. Here are the key takeaways from this week in Allergy and Immunology. First, nearly half of young children with clinically well-controlled asthma exhibit objective small airway dysfunction, and the majority meet high-risk criteria that are frequently missed by standard symptom-guided therapy. Second, a large majority of children with a history of reacting to concentrated sesame products can safely tolerate intact sesame seeds, suggesting supervised oral food challenges should be routinely utilized to expand these patients' diets. Third, real-world data on hereditary angioedema prophylaxis show high rates of non-adherence and persistent reliance on acute, on-demand treatments, reminding us that starting a preventative therapy is only the first step in a comprehensive management plan. Fourth, novel nanocarriers targeting Siglec-6 offer a highly selective approach to eliminating overactive mast cells, paving the way for targeted treatments with fewer off-target side effects. Finally, both local mucosal tolerance in food allergy and systemic immunity in oncology are deeply shaped by diet microbiome metabolite interactions, with specific amino acids like histidine playing a key role in modulating immune outcomes. That's your roundup for this week in Allergy and Immunology. The full transcript and references are available on the episode page in your AudioScholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.